Good afternoon, ladies and gentlemen. I hope that everyone enjoyed their lunch today, offered by IOM. The salmon was especially delicious. My name is Dr. Jim Sears, and I'm a pediatrician in private practice with my father and brother in Southern California. I am honored to have been given the opportunity to be here at the National Academy of Sciences in beautiful Washington, D.C., to speak on the behalf of the Institute of Medicine about the continuing concern of fish consumption during pregnancy. First off, I would like to make it clear that my choice of being pro-fish is due to my unremitting research conducted by medical professionals and also from my personal experiences with patients. My decision to agree with fish consumption during pregnancy does, however, have stipulations accompanied with it to ensure complete safety for both mother and child. Omega-3s and other important fish oils are a vital factor in human development, as well as in pregnancy. While there are plenty of fish that contain an abundant amount of healthy fish oils, there are also fish that are cause for concern. These are fish that are high in mercury content, and it could be potentially dangerous to not only pregnant women, but all individuals. By avoiding fish high in mercury and limiting the amount of fish that one consumes weekly, your pregnant patients can gain the health benefits that fish contribute while avoiding the dangerous possibilities. It has been found that fatty acids, EPA acid, and DHA acid are important in the support of pregnancy, lactation, and growth development of preterm and term infants. These acids are found in fish and don't exemplify the same benefits when given in supplement form. These acids also have been scientifically proven to aid in the explicit development of visual activity in preterm infants. It is important that these preterm infants are given as many advances as possible in order for them to catch up with their developmental timeline and have a chance at standard development. Studies conducted at the Christ Hospital in Cincinnati, Ohio, as well as multiple others, have discovered that maternal consumption of fish during pregnancy may prolong the gestation period and may increase the birth weight of infants. With this research, mothers who are at risk for premature birth will now have a better chance at extending the gestation period and give their child a better chance for fewer complications during and after birth. Mothers who are at risk of premature birth include those who are conceiving through in vitro fertilization, underweight or overweight, suffer from chronic conditions, smoke cigarettes, use alcohol, have poor nutrition, are under the age of 18 or over the age of 30. According to the Guttmacher Institute, 10% of all U.S. births to girls under the age of 19 and over 20% of births are to mothers over the age 30. With that said, many of our patients fall in the category of being at risk for premature birth. Knowing that, we can help them potentially prolong their gestation period and will put mothers at ease, as well as giving them a more nutritionally safe and satisfying pregnancy. Research completed at the Christ Hospital has also discovered that the DHA acid consumed during pregnancy may result in improved intelligence of children at the age of 4 years old. Observations have been completed on children whose mother consumed fish and children's mothers who did not at different ages. Of the children whose mothers consumed fish during pregnancy, there was an increase of intelligence as opposed to those children whose mothers did not consume fish. I'm sure that proof of increased intelligence in children will play a vital role in my patients' choices of fish intake during pregnancy. While the benefit of fish consumption during pregnancy seems to speak for themselves, we also need to be mindful of the potential risk that could occur if our patients are not properly educated on the harmful effects of mercury. In order to do so, we need to first understand that nearly all fish contain mercury. The amount of mercury is what we have to focus on, as well as the amount of fish consumed in a week's worth of time. According to the Children's Better Health Institute, it is recommended that women who are or might become pregnant should eat up to 12 ounces per week of a variety of fish and shellfish that are low in mercury. 12 ounces averages out to approximately 2 meals per week. The small amount of fish weekly can contribute to the mother's heart health as well as the child's proper growth and development. There are numerous types of fish that individuals consume year-round. Some of the most commonly eaten fish that have the lowest mercury content are shrimp, canned light tuna, salmon, croaker, flounder, perch, scallops, clams, oysters, tilapia, trout, and squid. These types of fish and shellfish can be consumed in 6-ounce servings twice a week. Fish and shellfish that contain higher contents of mercury include white canned tuna, mackerel, lobster, mahi-mahi, bass, snapper, and cod. These varieties of fish should be consumed in 6-ounce servings, but only once a week. These fish can still be enjoyed, but in responsible moderation. The last group of fish is those that contain the highest amount of mercury. These type of fish are to be avoided altogether during pregnancy because of the potential harmful effects of mercury. These fish include marlin, tilefish, swordfish, and shark. Aside from myself, there have been a number of medical professionals who have seen how fish consumption throughout pregnancy has positively impacted the mother and the child as well. There are also those who believe that fish consumption during pregnancy is dangerous to the mother and child, and I have been able to consult with these professionals on each opposing view. Dr. Jenna Ryder is a well-known and respected gynecologist who has been in obstetrics and gynecology private practice for the past 5 years. She has worked with hundreds of mothers and babies, as well as the numerous patients in the natal intensive care unit previously. When I asked Dr. Ryder if she would suggest that fish be in a pregnant woman's diet, she responded with a resounding yes. Nurse Ryder explained to me that she bases her opinion of being pro-fish off of medically proven research, focusing on selenium levels versus mercury toxicity. She stated that 16 out of the 25 highest dietary sources of selenium are found in ocean fish, and if selenium levels are higher than mercury, it is safe to eat. Dr. Ryder also explained the majority of commonly eaten species of fish in the United States have a higher level of selenium than mercury, making most of them safe to consume. Dr. Ryder explained her frustration of how Americans focus on the mercury content of fish and not the important part, being the selenium. She stated selenium has taken a back seat to the pandemonium of mercury, making individuals ignore the health benefits that it contributes to their diet in the fight against mercury. Research has shown that adequate amounts of selenium have been proven to prevent oxidative brain damage and other opposing effects associated with mercury toxicity. It has also been proven that selenium has a high binding affinity for mercury. This means that once the selenium and mercury have bonded together, mercury can no longer bond to anything else, making it no longer a threat to an individual consuming it. Another colleague of mine, who I have had the pleasure of consulting with on this topic, is Dr. Raja Hawit. Dr. Hawit is a distinguished pediatrician who has been in private practice for over 45 years. Dr. Hawit has abundant experience in working with pregnant mothers as well as newborns and premature infants. He has stated that he too is pro-fish as long as the patient is paying attention to their diet and making responsible choices. Of all the medical professionals that I have spoken with concerning fish consumption throughout pregnancy, only a very few have been absolutely anti-fish. The majority of them have their own opinions about what is a safe amount, but it continues to conclude that most medical professionals agree that fish consumption during pregnancy is safe in moderation and education. If your patient is educated on the types of fish that are higher in selenium than mercury and understand what amount is safe, then you can confidently ensure adequate safety and nutrition to mother and child. Thank you for your time, and I encourage you to keep an open mind and understand the vital health benefits that fish can contribute to your patients.